Today in the morning, the day started as usual. We were seeing the OPD patient and we were going to see the inpatient and ICU patients. During that time, one of the intern was calling us repeatedly. On picking the call, she was a bit agitated and panicked also. The reason for that is she had a needle stick injury while recapping one of the needle. On the back side, the patient she was dealing was hepatitis B positive. So she had a hepatitis B positive needle stick injury. So not only with that intern, almost many of the healthcare workers might have encountered this scenario. When I was intern, I also had one needle stick injury. If you take the data, more than 3.8 lakh people are being in the healthcare professional side being exposed to one or other form of the needle stick injury. Today we will see regarding how to manage these kind of scenarios and how to be safe during these kind of scenarios to prevent so that you won't the healthcare worker won't get these infections. Coming to the risk of infection, if we take the hepatitis B, the bloodborne virus, the spread can be because of the needle stick injuries, exposure of the contaminated blood or any body fluids. At least for the today discussion, any body fluid of the patient, be it pleural, pericardial, ascites, CSF, take it as contaminated. If there is exposure of the contaminated fluid to the mucous membrane, non-intact skin, or this kind of needle stick injury indicates exposure. Up to 30% chance is there for the spread of the infection. And not only the spread of infection, there is a risk of hepatitis also. Suppose if the source patient is both hepatitis surface antigen HBsAg positive and HBeAg positive, then there is a high risk of developing hepatitis up to 20%. The range is from 0 to 30% and it is highest with the direct blood related exposure. Apart from the contaminated body fluids, the mucous membrane exposure also shown to have transmittable infection, but the risk is more with the needle stick injuries. So whenever you encounter this kind of needle stick injury, what to do? First, wash that area with simply soap and water. How long to wash? There is no definite criteria. At least wash for minimum 5 to 10 minutes the entire injured area. If it is a mucous membrane, wash it with water. If it is a skin or hand, which is the most common site of exposure for the needle stick injuries, just wash it with soap and water for minimum 5 to 10 minutes. No need to squeeze it out. When I was a PG, there was a similarly one healthcare professional exposed to this kind of needle stick injury. They were trying to squeeze it. So if you squeeze, you try to take out the infected blood. That won't happen that way. The guideline says don't squeeze it because it creates some kind of negative pressure which increases the spread of the infection. So just through water and soap superficially, topically wash it. You can use a topical antiseptic. No need to use any injectable antiseptic. Those are not indicated. So just wash it. Second, try to find the status of the patient or the source patient from whom you got exposed. What is the HBsAg titer or whether HBsAg positive or not. Then HBeAg status. If it is known, well and good. If it is not available, no problem, take it. These are the two things you have to do first. Third, what is the vaccination status? If you have completed the vaccination, entire course of hepatitis B vaccination, and your anti-HBsAg titer is more than 10 milli international unit, that means you are protected. Yes, you are happy. You are not going to, most likely not going to develop any infection if you are vaccinated. And not only in India, almost all in most of the countries, for the healthcare professional, they have made it mandatory for this hepatitis B vaccination long back. So that is why it is very important to have your hepatitis B vaccination before your clinical posting starts or before the start of the internship. And whoever watching this, if you are a healthcare worker, make sure you got your complete course of hepatitis B vaccination and your titer have been checked. It have to be more than 10 milli international unit anti-HBsAg titer. That means you are protected. No further steps is required. Second, suppose you have been vaccinated and anti-HBsAg titer is less than 10. If the entire schedule of vaccination is done 2 times and still if the level of antibody is less than 10, or during this particular day after the exposure, if you are checking the antibody titer, if it is less than 10 milli international unit anti-HBsAg, then you have to take hepatitis B immunoglobulin. This is very important. It prevents the risk of transmission. Hepatitis B immunoglobulin at a dose of 0.06 ml per kg. It have to be taken intramuscularly. It have to be repeated after 1 month. Don't forget it. It prevents the risk of any transmission. So this is very important. So this is for those who got vaccinated and the titer is less than 10 milli international unit anti-HBsAg titer. Third, many healthcare workers might not be vaccinated. Suppose we take it this way. The healthcare worker by mistake, or he forgot, or he didn't, by some cause or the other, he didn't have taken the vaccination, or he forgot whether he took it or not. If he forgot, check the anti-HBsAg titer. If he didn't take vaccination, then he should be taking hepatitis B immunoglobulin IM, as I told the dose before, in one area intramuscularly, for example deltoid. On the other side, he have to take the first dose of hepatitis B vaccination. This have to be simultaneous. So once the first dose of hepatitis B vaccination is given, the schedule will be as usual after 1 month, 2nd month, and the 3rd and the 6th month. These have to be regularized. Depends on the type of vaccination you are taking. There are 2 types of vaccine. In India, the most commonly used one is the 3 or 4 doses vaccine that have to be taken. So first dose of hepatitis B vaccine along with immunoglobulin. This is for those who didn't take any prior hepatitis B vaccination. So that's all. First, wash it. Check the source patient status. If hepatitis B surface antigen is positive and hepatitis B E for elephant antigen is positive, the risk is somewhat higher. You have to be very careful. Check your vaccination status. If your titer is more than 10 milli international unit, no need for any further treatment. Suppose if your titer is low, take 2 doses of hepatitis B immunoglobulin at a gap, first dose now and 2nd dose after 1 month. This hepatitis B immunoglobulin is shown to be very effective if it is taken within 24 hours. So that is the purpose of this video. See, I want to make sure just you have to check the titer, because it might take 1 day for the report to come. And if you are aware that hepatitis B immunoglobulin is most effective if it is taken within 24 hours, or max to max you have to take within 7 days. So if the time period is lapsed, there is a risk of transmission of hepatitis B. So mostly healthcare workers, at least in the India, interns might have been vaccinated. So most likely, if the titer is high, nothing to worry. Low, take hepatitis B immunoglobulin. If not vaccinated, take 2 doses. After a period of time, go for the hepatitis B vaccination full course. And how to do follow-up? After 6 months, your hepatitis B antigen HBsAg and HBsAg level have to be checked. Positive, negative, that test have to be done after 6 months to make sure the infection not transmitted. That is one thing. And during that follow-up of 6 months, don't donate blood, just to be on the safer side. And to conclude the video, I wish your antibody titer is more than 10 and nothing to worry about the transmission. Bye bye.